So, staying true to our mission to convene the health policy community, it's our hope we add value to this conversation. Sorry, I had to throw in one value pun. We want to add value to the conversation. We hope you think about some questions that you want answered, and we hope that you get them answered, and that each of you leaves today with a new idea or a new perspective, or even one new connection that can help with your day-to-day work in this space. So before we get started, I'd like to say thank you to our 2019 Solving for Health Signature Series sponsors, some of whom you will hear from throughout the morning. We'd like to thank Pharma, our visionary sponsor, our innovator sponsors, Anthem and Ascension, our champion sponsors, Aetna, the Blue Cross Blue Shield Association, Cambia Health Foundation, GlaxoSmithKline, and Kaiser Permanente, and our signature sponsors, Bristol Myers Squibb, Merck, and Nemours Children's Health System. To start the morning off, I'd like to invite Mike Ibarra, who is Vice President of Advocacy and Strategic Alliances at Pharma, to give some brief opening remarks. Welcome, Mike.
Good morning. Thank you, Sarah. I'm really excited to be here to have to participate in this important discussion about how we navigate this exciting time of rapid innovation in healthcare. Always excited to be at Alliance events. You all do a fantastic job of convening these important conversations. As I think many of folks in the room know, we're in an era of tremendous innovation where there's breakthrough science that's really transforming patient care. I see it in the emergency department when I work clinically, most recently on Monday night until about 1 in the morning, taking care of patients who really want to see this innovation. And it's very, very humbling when we're able to offer them innovative therapies that meet their needs, but it's even more humbling when we can't. Just last year, the FDA approved a record 65 new medicines to help bring those innovations to patients, including 3 new medicines to treat migraines, a new treatment for patients that have drug-resistant HIV, and a new personalized tumor-agnostic cancer treatment. And what this means is it was approved based on its ability to treat a specific genetic mutation as opposed to tumor type. So instead of approving based on breast or colon cancer, it was approved based on the genetic mutation that the cancer might have. These are really important innovations, but we also recognize that these advances are not meeting the needs of patients if the patients can't afford them. So we see that the status quo is not working for many patients, and despite a traumatic slowdown in medicine spending and medicine prices, out-of-pocket costs for some patients continue to increase. Because of negotiations that are happening in the market, the net price for medicine last year grew just 0.3%. which is far less than the rate of inflation and less than the rate of increases that we saw in other aspects of the healthcare system. And that's net prices, meaning after rebates and discounts have been negotiated. And some patients see a different situation, though. When they go to the pharmacy counter, they're often asked to pay more out of pocket this year than they have been in the past. And so at Pharma, we know that we and our members have a responsibility to participate in this conversation. It's not just about researching and bringing new medicines to market, but also help patients access them. And that's why we're very, very proud and pleased to be a sponsor here and working with you all to fix the healthcare system so that it works better for patients through policies that ultimately lower the out-of-pocket costs for patients, while also avoiding reductions to patient access and limits to innovation. So one of the big ways that we think we can accomplish this goal is by this conversation, moving towards a more value-driven healthcare system that prioritizes results that really matter to patients. And so one way to do that is through value assessment, which I know will be a robust part of the conversation today. We think value assessments are an important tool in moving towards a better, more affordable healthcare system. But the performance of a medicine should not only be measured based on how it might drive down costs in other aspects of the healthcare system, like avoiding unnecessary hospitalizations, but we do think it's very important to take into account those patient-specific considerations. How does it improve their quality of life? How might it impact their ability to go back to work or to interact with their family? And also, very important to me personally, value assessment should support the doctor-patient relationship, not interfere with the doctor-patient relationship. We should avoid using methods that ignore what matter most to patients and that might interfere with that very important interaction. So we do need safeguards as we're developing value assessments to make sure that patients are protected against the misuse. We also know, and Sarah alluded to this, that not all patients benefit equally from each medicine. So we need to make sure that we have a healthcare system and value assessments where payments for these medicines reflect these important differences. How we currently pay for medicines may not be the best approach, particularly for some of these new and innovative therapies, as they don't always reflect that different medicines are best for different patients, and they often leave patients with high out-of-pocket costs and other barriers to care. And so that's why a number of our members are exploring value-based arrangements or results-based contracts. These value-based arrangements are an innovative approach to paying for medicines that often involve greater risk sharing between payers and manufacturers. And so as a result of these arrangements, payers may make medicine more accessible to patients, and biopharmaceutical companies might agree to take on more financial risk in order to be reimbursed based on how well that medicine might work in particular populations. So in exchange for this balance, biopharmaceutical companies might negotiate more favorable access to a new medicine that could result in lower costs for a patient, allowing them to access medicines earlier. And we see that these arrangements are starting to really take off, that they're on the rise. 1 in 4 health plans have reported already that they're engaged in at least one results-based contract with biopharmaceutical companies, and many are testing these arrangements, particularly for new innovative therapies like gene therapies. So as the name of today's summit suggests, we think we really are at the frontier of a new area of innovation and value, both in terms of how we treat diseases, but also how we look at paying for those therapies. And so with better information, a focus more on outcomes that matter to patients, and then flexible new approaches to paying for medicines, we think we really can advance a value-driven healthcare system. Thanks so much, and look forward to a great conversation.